Welcome to the Rim Break Rodeo. We hope this video helps.
You begin by seating the patient and checking chin and forehead rest so the eye sits level. Clean the keratometer and set the eyepiece to your comfortable near focus. This avoids parallax. Once done, have the patient fixate on the internal target and close the fellow eye. Move the instrument in until the Meyers are visible and roughly centered, about 1 to 2 centimeters from the cornea, so you can start precise alignment without delay and maintain a steady head position. You now refine alignment. Use the joystick to center the Meyers over the pupil and ensure the reticle crosshair sits on the corneal apex. Then slowly turn the focusing drum until both inner and outer Meyers become crisp and concentric. This gives accurate radius readings. Next, rotate the axis drum to align the principal meridians so the Meyers overlap symmetrically. Take your time. Small joystick or drum corrections matter. If images wobble, pause and restabilize the instrument before making measurements. You finish by reading the diopter and axis values directly from the calibrated drums, record 2 consistent readings per eye and average them for reliability. Ask the patient to blink and remeasure if tear film causes distortion, and always verify fixation remains steady. If Meyers remain irregular, reposition the instrument and refocus, then realign the axis. This solves most issues. One key troubleshooting tip: if readings fluctuate, reassess patient head position and tear film first. Corrected fixation.
Thanks for watching. Consider subscribing if we helped you.